Principles of acid-base balance. An arterial blood gas, also known as an ABG, is a blood test that measures the levels of oxygen, carbon dioxide, and acid-base balance in the patient's blood. It's a common test used to diagnose and monitor conditions that affect the lungs, kidneys, and other organs. The amount of oxygen in your blood shows how well your lungs move oxygen into your blood when you breathe in. The amount of carbon dioxide in your blood shows how well your lungs remove carbon dioxide when you breathe out. The acid-base balance, also known as the pH level, is measured to check how well your kidneys and lungs are working to maintain the body's acidity level. A normal pH level is 7.35 to 7.45. ABG tests can help diagnose respiratory failure and other conditions that affect the respiratory system, circulatory system, and metabolic processes. A pH imbalance can cause symptoms such as tingling, weakness, irregular heartbeat, seizures, hyperventilation, cramps, and an altered mental status. Respiratory acidosis. Respiratory acidosis occurs when the lungs cannot remove all of the carbon dioxide that is formed in the body. This causes the blood to become more acidic, thus causing the body's pH level to fall. Respiratory acidosis can be caused by the following: breathing problems, cardiac arrest, lung disorders such as COPD, emphysema, asthma, or pneumonia, neuromuscular disorders, obstruction of the airways, scoliosis, sedative overdose, and severe obesity. In the pre-hospital setting, we need to increase rate and depth of ventilations by using a bag valve mask on them, which will help provide more oxygen and get rid of some of the CO2 for them. Respiratory alkalosis. This usually occurs due to alveolar hyperventilation, where the lungs are giving off too much carbon dioxide, causing the pH level to rise and a decrease in PCO2. This can be caused by stress, pulmonary disorder, thermal insult, high-altitude areas, aspirin overdose, fever, hyperventilation, or liver disease. In the pre-hospital setting, it is important to reassure the patient. Make sure they are in a comfortable position in an attempt to decrease the rate and depth of ventilations, followed by rapid transfer to hospital. Metabolic acidosis. This is an electrolyte disorder that occurs when the body has too much acid in its fluids. As the body produces too much acid or can't remove enough from the blood, causing a decrease in pH and bicarbonate. Normal anion gap causes of metabolic acidosis includes hyperalimentation, meaning usage of total parenteral nutrition. It is a form of nutritional support that is given directly into the bloodstream. Acetazolamide use, which is a carbonic anhydrase inhibitor, which can be used in drugs to treat glaucoma. Renal tubular acidosis, which can be specified to type 1, distal convoluted tubule. Type 2, proximal convoluted tubule, which causes low bicarb, or type 4, low aldosterone or hyperkalemia. Diarrhea, which can cause a loss of bicarb, as it causes a disproportionate loss of sodium. Whereas in vomiting, the patient loses acid, as it causes loss of hydrogen ions. Uterosigmoid fistula causes the colon to waste bicarb, as the shortened segment does not absorb alkaline during urinary diversion. Pancreatic fistula, as the pancreas secretes bicarb-rich fluid. In the pre-hospital setting, it's important to increase the rate and depth of ventilations. Consider bicarbonate. It works similar to how an antacid works for your blood, as it helps bind up the acid in your body and turns it neutral. Metabolic alkalosis. This is when there is a decrease in hydrogen ion concentration and bicarb concentration, causing an increase in the pH level. Causes of metabolic alkalosis include Cushing's syndrome, caused by having too much of a hormone called cortisol in your body. Mineralocorticoid excess, also known as primary hyperaldosteronism, or Conn syndrome, that occurs when the adrenal glands produce too much of the hormone aldosterone, which helps regulate sodium, potassium, blood pressure, and water balance. Stenosis of the renal artery, which is the narrowing of one or both of the renal arteries, most often caused by atherosclerosis. Renal failure, which occurs when the kidneys can no longer filter waste from the blood at a sufficient level for survival. Each of these things will cause the patient to become hypertensive. Licorice, as chronic consumption of licorice can cause metabolic alkalosis. Alkali. Hypokalemia, which is low potassium. Hypomagnesemia, which is strongly associated with hypokalemia. Barter's syndrome, which is a neurometabolic disorder and is a rare autosomal recessive disorder of the renal tubules. This group of things can present in normotensive patients. The management of this type of patient depends primarily on the underlying etiology, current symptoms, and on the patient's volume status. Subscribe to the channel for more.